Hi, I'm Scott Lundstrom. I'm the Group Vice President for IDC Health Insights. I run their research group worldwide. Sure, so from our perspective, there really are four pillars or four core technologies of transformation in healthcare. The first of those is cloud. We see cloud as an opportunity to reduce costs, reduce capital, increase agility and speed from a deployment perspective. Business intelligence and analytics, the largest single spend category in the healthcare industry now among payers and providers. Mobility, really driving changes in the way that we interact with patients and we engage with members. And finally, social media, really changing the way that we take comments and feedback and discover problems in the delivery of care. So really, I think there are a couple of things. One is to look at leaders in your industry, and I think there we really look to the large integrated delivery networks. They have some unique opportunities in terms of being well capitalized, and they have some immediate opportunities to experience financial improvements as a result of implementing reform. So certainly the large integrated delivery networks seem to be ahead of the curve, and they're a good place to look. We're also encouraging CIOs to look outside of healthcare. I think there's some great examples from other industries. If we look at how mobility and consumerism has changed retail banking, we're going to expect to see very similar changes in healthcare. And some good lessons there from a security perspective, from an availability perspective, from a how do we engage with consumers in an area where we're really a trusted advisor. And honestly, the only thing people are more concerned about than their financial data is their health data. So a lot of interesting corollaries there to learn from. And then from other industrialized markets, healthcare is not just about delivering care, it's about delivering it with quality in a cost-effective way. So we find that quality is an area that's been studied by other industries. We see techniques and approaches like Six Sigma and Lean really gaining traction in healthcare. So I think there's no shortage of good examples and good lessons out there. The real difficulties seem to be with leadership, capitalization, and access to appropriate services and support. Sure, for a supplier, it's really all about solving a hard problem. I think if you were to meet with a payer or a provider, CIO, very quickly they can manufacture a list of 40, 50, 100 real problems they were trying to solve. And what they're looking for is someone to come in and take that problem off the table for them, provide them a solution, an answer. Customers are not interested in buying technology. They're not interested in buying science projects. They're not interested in buying open-ended services agreements. They really want a solution. And for a supplier, really the best thing you can do is to take an example of where you've helped the customer solve one of these hard problems and begin to publicize that, to make it known. But you have to be in the problem-solving business, not in the technology delivery business. So 2013, challenging year. From my perspective, maybe a little tongue-in-cheek, a year of diminished expectations. While reform is through and now the law of the land, execution and implementation is well behind schedule. By the end of the year, we would hope to have retail health exchanges in most states and meaningful use implemented and kind of, again, the rule of law in the provider organizations. In both cases, I think we're going to miss. It's not a matter of people not understanding the rules. It's more a matter of limitations and constraints and capital, available talent, and uncertainty about what's really required from a rule and regulation perspective.